So we just finished our first relaunched new big room. Fantastic number of people came today to get engaged with it. There are three things really that I'm asking people to take away from the conversation we've had today. The first is that really it's not about a room. This is about a conversation we want to be having right across the organisation at all levels about our bold improvement goals and what we're trying to do to move what we're offering to our patients, the people we serve, and taking that into a better, more reliable, more consistent place. Second thing I've asked people to bear in mind is that this is something that we work on together. It's not a monologue, it's not from the top. This is something that I think everyone can contribute to. All of the things that we're doing in Bold Improvement Goals have an impact on virtually everything that we do. And whilst everyone can't claim to be involved at every level, every stage, I do think this is going to be a big vehicle for making sure that everyone can participate and get engaged with what we need to do. Some of the things that we're focusing on, like for example making sure that we keep our promises in terms of how long people are waiting for treatment, I think that's a highly relevant, clinically relevant, patient experience target. And I don't really have very much time for people saying we shouldn't be working at targets. These are things that I think people should expect us to be able to do. And the theme of today, in a sense, is if we can find a way of doing those, reaching those, attaining those goals consistently and reliably, the good news is it will all come together in better quality, better performance, and really importantly, a better financial position for the organisation. And just at the moment, we are at a very crucial juncture. We need our plan approved. And I think if we can secure the sort of delivery that we've been having over the last 5 or 6 quarters, we put ourselves in extremely good shape to make that happen. We also know that if we're going to have this conversation happening consistently across the organisation, more and more people need to hear about what we're trying to do and hear about what we're saying it's all about. And so we are going to be starting to use things like Periscope and Facebook and thinking about how can we get the conversation we need to be having interactively with people more or less consistently and continuously right across the working week. And so you'll be hearing more about that in the days and weeks to come, I'm sure.